stay in Queen's Park now to the passing of Bill 7, a controversial bill, according to some, which would allow hospitals to move patients waiting for long-term care and other alternative care means into nursing homes, not of their choosing, on a temporary basis. Now, the opposition says this only hurts Ontario's seniors. However, the chief doctor at Hamilton Health Sciences and Emergency Medicine says this move is necessary to ease the pressure on the healthcare system. With the province passing Bill 7 without public hearings, the interim leader of the official opposition used question period today to share his concerns.
Will the Premier do the right thing? Admit that this dangerous scheme was rushed and pull Bill 7 today?
I've never, ever seen all CEOs agree across the province, all frontline healthcare people agree, all doctors agree. The only people that don't agree with this plan is the NDP. Despite its passing, Bill 7 still lacks details regarding how far a patient could be transferred and how much money they'll have to spend to stay in a hospital bed. The opposition fearing the worst.
They wouldn't directly answer the question. Says to me that people are going to get hit with very big bills. They're going to have incredible financial pressure. This is going to be crushing for seniors. It's going to be crushing for their families.
Meanwhile, CUPE, the Advocacy Center for the Elderly, and other agencies are asking for the Human Rights Commission to investigate the bill.
They have not improved long-term care for people. They're sending people to the worst homes that they don't want to go to, far away from their families, isolated from their communities and their loved ones. It's like we've learned nothing.
Despite the backlash, the chief of emergency medicine at Hamilton Health Sciences, Dr. Kuldeep Sidhu, says the bill is needed to help alleviate the capacity strain hospitals across the province continue to experience.
These beds are acute care beds, and having them filled with patients that are no longer have any acute care needs is causing a lot of congestion and problems for the system.
HHS says it's treating 200 patients in need of alternative care. About a third are looking for places in long-term care homes. The rest are in need of home care or assisted living. Dr. Sidhu says in the end, hospitals are just not the best place for people in need of long-term care.
There's sick patients coming in that could be in the next bed that may have, MRSA or VRE or et cetera. And despite infection control measures, we still get outbreaks within hospitals. There's other things that you don't find in acute care hospitals, such as all of the social, needs that long-term care are able to provide, as well as for the families in visitation, that long-term cares are able to provide, that acute care hospitals don't have that same degree of comfort.
And when it comes to moving a patient, Dr. Sidhu says doctors will not be forcing patients to do anything they don't want to do.
The intent is not to make people drive 150 kilometers, right? But there's still some capacity within the system because people are not choosing that one. And some of it may just be that they heard things or they've read things online. So, maybe going to see some of these homes with families will help them to choose.
As for those daily rates to stay in a hospital bed, the province says those costs will likely be made public next week, where Premier Doug Ford said yesterday that patients won't be charged an uninsured rate of $1,800 a day, as some critics have suggested.